Welcome to the On Your Mind podcast, where we believe mental illness can be temporary and transformative. Stay tuned for innovative, effective tools from experts in the field of mental health. Hosted by Timothy J. Hayes, psychologist. This podcast aims to change the narrative around mental illness. Move from a place of fear to a place of hope and solutions. Here on Your Mind.
Dr. Jodie Skillicorn is board certified in psychiatry and neurology and a diplomat of the American Board of Holistic Integrative Medicine. Dr. Skillicorn is the author of the book Healing Depression Without Medications, subtitled A Psychiatrist's Guide to Balancing Mind, Body, and Soul. Dr. Jodie, it is a pleasure having you agree to this interview. I found out about your book, and I found out about the similarity in our trainings, and I was excited to get together with you. So thank you so much for joining us today.
Well, I'm happy to be here. Excited to talk to you too.
How did you get into this from a traditional psychiatrist perspective into the perspective that you've shared with us in your new book, Healing Depression Without Medication?
Well, that's where I started, actually, and then I forgot when I got into medical school. But I had no interest in medicine. I sort of have an inherent distrust of the medical system. But then I read, I was actually in graduate school for visual communications, photojournalism, and I read my last week there. I had finished everything up, was waiting to start a job, and I read Christiane Northrup's book, Women's Bodies, Women's Wisdom. And I immediately felt this is what I want to do. Like the mind, body, spirit, like it just made so much sense to me, that connection. And so I actually called my parents and I was like, this is what I want to do. And they're like, well, you just finished grad school. Maybe you should work for a little bit. And I was like, yeah. So I did that and I kind of forgot for a little bit. And then it came around and I ended up, well, in journalism, I started to feel like sort of a vulture on the side of the road. And so I eventually ended up back in school. And in medical school, I started to forget that this is why I had started medical school, because you get it's so dogmatic, and this belief that medicines can solve every problem, and this whole system is based on finding pathology, and everything's treated with medicine or procedure. And I started to buy into it too, right? It just seemed to have, it's simple. You just take a pill, it solves everything. And then when I decided on psychiatry and went in and started residency, I started getting the same, all the patients I was seeing were patients that had already been seen by the person before me and the person before them and the person before them and the person before them. And I was thinking, well, if these medicines are so great, as I've been told all through medical school and now in residency, why are people not getting better? Like, it just doesn't make sense. And so I then sort of go back to what I had been learning before all this. So before I started medical school, I did a yoga teacher training. I'd been already meditating at that point for about 20 years. Now it's closer to 30. And so I already had all these practices that I knew worked for me. And I was a pretty inherently anxious person, still am, but not nearly as much so. And I knew how effective these tools were for me. And so I started using them with my patients and found that they were effective for them as well.
So was there I seem to remember you mentioned in your book that there was a critical book you read by Dr. Whitaker?
Yes. Anatomy of an Epidemic. And so I read that book. And so I'd already started to sort of question a lot of things. And then I read his book, and his research just exploded everything that I'd been taught. It just blew it to pieces. And what his research suggested was that, these meds were actually making things worse, not better. And that, in fact, depression and other mental illnesses, well, specifically depression, in the past had been something that was only a minority of people develop chronic depression. Most people the vast majority, it was an acute problem related to some immediate stressor or some childhood stressor. But there was an antecedent and there was a reason for it. And for most people, it would pass within 6 months to a year. That was the norm. And if you read the literature from the National Institute of Mental Health, that's what it was stating. And then once medications came in, that all started to shift. Now, it would be an abnormality for someone to have depression and for it to see a psychiatrist and for it to pass quickly. Now the message is it's chronic and you're going to need to be on these medications for the rest of your life. And the story I was told was, if you've had one episode of depression, there's a 50% chance of having another one. And if you've had two, there's a 75% chance. And if you've had three, it's 90% or higher. So basically what I used to tell people is, you're broken, you're sick, and if you don't do what I say, which is basically take medications, you're going to be sick forever. And so of course that's what happens, right? We tell people that and that becomes the reality and no one expects any differently. I often think of it similar to in the past with stroke patients. So the prevailing message in the past was that our brain could not change, that we had a certain number of neurons, and as we got older, they would slowly die off. And so if you had a stroke or you had something, right, there really was nothing you could do. And so there was nothing you could do. People did not get better. But today we know that's simply not true, that with lots of therapy and lots of training and repetitions, you can retrain the brain, you can regrow the brain, you can rewire the brain. And so now when people have strokes, right, we know that they can maybe not get fully better, but they certainly can improve and erase some of those deficits. And so why would it be any different for anything else dealing with the brain?
Well, and you quote in the book and bring us back to it over and over again, the idea that our brains do not discriminate between the real and the imagined. And if you combine that with what you were just talking about and the knowledge that came up, in 2004, I think was the first time they did an experiment where they actually were able to track and scan the rewiring of the neural pathways and what they're now calling memory reconsolidation. The brain is always learning, changing, and growing. But if we keep feeding people the belief that you're damaged, you're broken, you're going to have to take this pill forever, they think it, they come to believe it, and then that reinforces those neural pathways, and then they get stuck there. But it doesn't mean they have to stay stuck there.
Right, absolutely. I mean, it's basically the nocebo effect. We're basically disempowering people and making them helpless and hopeless. And so that's exactly how they stay. And so it's no surprise then that the outcomes are far worse.
Right. And so I want to just clarify what you just said there very quickly. You talked about the nocebo effect, and a lot of people listening may not know what that means. The placebo effect and the nocebo effect are diametrically opposed. Can you speak to those powerful forces?
Sure. So the placebo effect is what, so anytime a doctor gives a pill or even just support and guidance and the brain, we tend to think of placebo as just a placebo, but the reality is the placebo is incredibly powerful. And the pharmaceutical companies have to spend a whole lot of money and do a whole lot of manipulations in order to make their medications better than a placebo because it is so effective. In fact, one of my favorite studies on placebo was, it's not on depression, but it was irritable bowel syndrome. So this was 2010 with Dr. Kapchuk. I think is how you say his name. I'm not sure. But he did a study where he took two groups of people with irritable bowel, and one of them received the best medication at the time for irritable bowel. And the other group received placebo. And not only did they receive placebo, but they received a bottle that said placebo on it. They were told they were giving placebo. There was no hidden, right? This wasn't hidden. It was right out in the open. But they were given a lecture on the power of placebo and how it had been shown in multiple studies to be effective for irritable bowel syndrome. And what they found, in fact, was that those on placebo did just as well as those who'd received the most expensive and the most, what was considered the most effective medication then. And so it's incredibly powerful force. It changes the brain and the body in similar ways to an actual medication. And so and it doesn't even require a belief in it. you cannot believe in placebo and still have a placebo effect, just because we're so hardwired to believe in the power of pills and our doctor and the system. And because we believe in that, that explains a huge percent of why the medications, all medications, not just psychiatric medications, work. And nocebo effect is just the opposite. So nocebo is to do harm. And so nocebo is when we plant this idea, you're broken, you can't get better, this is a chronic disease, or cancer, you're going to die in 6 months. I mean, lots of people die on the 6th, like basically to the day, because this idea has been planted in their head that that's the outcome, that's what's going to happen, and it becomes the reality. And again, my favorite nocebo study is, it was just a case study. It was a guy they called Mr. A. He was a 26-year-old who was depressed because he'd, after a breakup. So again, it wasn't really the pathology. He was just distraught over a breakup with his girlfriend. But he ended up in this study, and he was given for antidepressants. And so in this case, so he got better after he started taking the medication. And then a couple of weeks later, he got in a fight with his ex-girlfriend, and he impulsively went and overdosed on all these pills and immediately regretted it and called for help. But meanwhile, right, he was getting all sweaty, and his blood pressure was dropping, and his heart rate was up, and he was, lightheaded. And so the ambulance came and documented all of this, and they called to figure out what medication he was on. And a couple hours later, while he was still having all these symptoms, the person from the study arrived and basically announced, it was placebo, you weren't on anything. And immediately within 15 minutes, he had totally recovered and was totally back to normal. But the point is the medications can cause side effects in the same way if we believe it, as in the same way that a placebo can help us get better. Right. So it's all, so it's incredibly powerful. It changes our physiology in really profound ways.
Right, the power of the mind. And Bruce Lipton suggested in his book, Biology of Belief, back in the 90s, why don't we start calling it something more accurate, something like the power of the mind or the belief effect rather than the placebo effect? And people like Eric Vance dug into it and wrote the book Suggestible You, and talked about the power of both the placebo and the nocebo effect in a study that was done on a new treatment for Parkinson's. It's rather dramatic. They had to drill a hole in the skull and inject this particular medication into the brain.
Oh, geez.
And so they did this study, and you wonder, well, how can you have a placebo for that? Well, simply because they, just like the knee surgery placebo studies they've done, they make an incision and then they just make a little indent in the bone without going all the way through, and they take all the time they would if they had the regular procedure. So some people actually had a part of the skull removed and then the injection and then sewn up, and other people just had a little indent put in the bone and then no injection of meds. Well, this one person who had tremendous negative effects of Parkinson's that really, really put the brakes on his life and his ability to function with his kids, in the study had a tremendous positive result, and they were thrilled. And it's a double-blind study, so his doctor didn't even know whether he'd gotten the medication or not, but they just absolutely assumed that because his improvement was so dramatic, he must have gotten the medication, and they must have just found a powerful cure for the symptoms of Parkinson's. Well, as all of these studies work, they're set up so that after a period of time, they have to notify people whether they got the actual medication or the placebo. And when the time came, the man and his doctor were both blown away by the knowledge that he got the placebo. He didn't get any medication, but his life was powerfully transformed. So the role of belief in the symptoms of Parkinson's, if somebody tells me you have Parkinson's, this is a progressive disease and you're going to have decreased functioning until the point where blah, 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 I start to believe that, it actually starts to affect my physical functioning.
Absolutely.
On the other side of the coin, in that very same study, which, by the way, they had to say was not a tremendous cure for Parkinson's because the people that got the medication didn't get that much better. And some of them didn't get anywhere near as improved as the man in this particular example who got the placebo. But in that study, the nocebo effect was so powerful that the people in the placebo group got more and stronger negative side effects than the people who actually had the medication injected into their brain.
Wow. Wow. Yeah, that's a great story.
So that's the power of the mind.
Yes, it's incredibly powerful.
And you've already touched on the idea that for a variety of reasons, your medical training was so clearly focused on the belief that medications had to be the cause of healing, and that pathology was the primary focus, and then the correction, or at least alleviating the symptoms from the pathology, was the path. And then you read the Whitaker book, and your eyes were open to the fact that, wait a minute, there's an entirely different set of interpretations and different research out there that says this stuff isn't what the medical profession tells us it is.
Or more importantly, that research is hard to find and often buried from the medical literature, right? You have to dig for it. Pharmaceutical companies make it really hard to find information that show that their medicine doesn't work as well as.
Well, yeah, and there's a powerful thing that's in the first part of your book where you're talking about all this, that really it kind of opens up one of the problems with peer-reviewed studies in journals. And that is that if you have 5, 10, 12, 30 different studies that don't get any positive results, where there's no statistically significant difference between this treatment or that factor, there's no even a correlation, much less a cause and effect relationship proved, it's almost impossible to get those studies published in a journal.
Yes. Yeah.
And so let's say that I had this idea that strawberries cure depression, and I do a study and it comes out and there's no real difference between people that eat strawberries and don't. But I'm convinced that strawberries are powerful. They've got this one ingredient that I know. So I do the study 4 more times. And each time there's no effect, but I get some money and I do it 12 times. And on the 12th study, you know what? There's a statistically significant difference between the people getting less depressed if they ate strawberries than not. No one knows about the first 10, 11 studies, but I can very likely get that 12th study published in a journal. And it's not just me as an independent researcher, but you were talking about how common that is for the drug companies to do several levels, if not many trials of their drugs in order to come up with some that are statistically different or significant, and then get the FDA to approve their medication.
Yeah, you only need 2 positive studies and you get as many tries as you want. So for example, I think fluoxetine, there were 8 studies and 2 were positive. So the fact that 6, failed, that never shows up in the literature. And it's the same for all the other antidepressants. As far as I know, there were multiple negatives. And so part of what they do, it's not just keep redoing it. It's figuring out who's most receptive. Again, it's kind of taking advantage of the placebo and nocebo, like who's least receptive to placebo, but who's most receptive to nocebo. And so you can kind of twist and get the population you want that may give you the result you want. But again, there's all these other studies showing just the opposite result. So the clearest example of that is there was a study done in 2008 by Eric Turner and colleagues in the New England Journal of Medicine. And in this one, I may not get my numbers exactly right, but basically it was one of the first studies where they got access to all of the studies they could using the Freedom of Information Act. So they got access to not just the studies that were published, but also the unpublished ones. And so they ended up with, I think, 72 studies. And so of those, 38, I believe, were positive and 36 were negative. But here's where it got interesting is of the ones that were positive, all but 1 were published, right? So that's what your physician's seeing, that's what your psychiatrist is seeing, that's what they're basing their information on, is based on these studies. But of the studies that were negative, all but only 3 were published. And of those, I think it was only one, only one actually showed the actual effect, that it was negative. The others sort of buffered it up to make it look more positive than it was. And the rest were just buried. So as a physician, right, even if my best intention is to find, right, the best information for my patients, if I don't have access to that information, if it's all being buried and only, every once in a while does a study negate what I've been taught, or negate, sort of the standard belief that these medications work, then I'm just going to dismiss it because it's, 97% show it's positive. I'm going to ignore those few that don't. But the reality is if all those negative ones are being buried, I'm not getting accurate information. And so I'm making decisions based on only half the facts.
And then that data that's published and promoted in collegial discussions is feeding the conclusion that depression is caused by this absence of a certain set of chemicals in your brain. Can you talk about that?
Yeah, so the predominant, what we've been told since medications were basically discovered, is that there is the neurochemical imbalance. So if your depression is, basically low serotonin, lower norepinephrine, low dopamine, so you have lower than normal levels of these neurochemicals, these neurotransmitters. And that's what all the medications are based on, is based on increasing the levels of these neurotransmitters. But what the data overall shows is that, in fact, a quarter of the population, whether they have depression or whether they don't, have low neurotransmitters. A quarter of the population has high neurotransmitters, whether they have depression or whether they don't. And the rest of us are in the middle, which indicates, right, there is no normal. And to think that it is really kind of delusional, because it's such a complex dance. There are so many. It's not as if there's just these 4 neurotransmitters. There's hormones and other chemicals in the body that are acting as neurotransmitters, and they all interact and it's this dance. And then if there's gets more, then the body tries to modulate, and the the receptors become less receptive. And so it's very complex. And so to think that it's just these one things, and even the founders of this neurochemical imbalance theory thought that it was preposterously simple, that it was just a piece of the puzzle. But the pharmaceutical companies have really sold us on the idea that that is the puzzle, and it has sort of shifted over time from, even at the beginning, the medications were sort of presented to the public as what they were, which is they can help reduce symptoms temporarily, but if you stop, the symptoms will come back. And then it gradually became that it was, a cure. And yet at that exact same time, the chronicity of mental illness has gone up and up as we continue to use the meds. And so, so we've just been getting a message that's just not true. But what the research is pointing towards is that it's more an issue, just like all other chronic diseases. And again, the brain is part of the body, and the body is part of the brain. It is not a separate, it's not as if we're bobbleheads walking around, with just little, with these big heads and our irrelevant bodies. It's all connected. And so what the research shows is that it's really, like other chronic diseases, an issue of inflammation. And this inflammation can be caused for lots of reasons. One, just chronic stress of the crazy way we live and constant busyness and doing, but also the correlations are incredibly high for early childhood trauma. So for example, for someone who hasn't experienced any of, in the trials, with the examples they use for child trauma, which would include physical, sexual, and emotional abuse, losing a parent, whether it's to divorce, to death, or jail, emotional neglect, and so these kinds of traumas. And what they found is, if someone hasn't experienced any of these, and honestly, I don't see anyone who hasn't experienced any of them in my practice anyway, But there's about a 12% chance of having an episode of depression in one's lifetime. But if someone's had one trauma, early childhood trauma, that goes up to 25%. 2, it goes up to 40%. And by the time you're at 4 of these events, which is not all that uncommon, there's a 400% increased risk of depression and a 1,200% increased risk of suicidality. And it's the same across the board. So if you look at alcoholism, for example, it's about 800%, and drug addiction about 500% increase. So these numbers are huge. There's correlation between these early childhood traumas, and it makes sense because when we're small, it changes the way our brain is developing, our nervous system is developing. It changes the way we see ourselves or not see ourselves as safe in the world, and how our body sees ourselves or not sees ourselves as safe in the world. It changes the way our the structure and function of the brain and the nervous system. And so those results have been shown in studies when they follow people 20 years, that you can still see the inflammatory effects of those early childhood events. And so that's really where the research is pointing now. But unfortunately, there's about a 17-year gap between the research and what actually is happening in a doctor's office. So we're perpetually behind.
Right. Although the hopeful note here is that as I've been in the field and interviewing people, those who are working in systems that might be labeled functional medicine, holistic medicine, or integrative medicine, whether it's in the mental health field or the physical health field, they have been working on models that accept that whole body system, energy system approach.
Yes.
And so it is possible to get a clinician who will help you look at your entire energy system, which is not separated mind from body or vice versa.
Yes.
There's a woman in Australia, her first name is Allison, I think her last name is Davies, and I interviewed her a while back. She talked about how the research about the level at which the level of external stimulation in which our brains developed over the centuries and thousands of years is so dramatically different from the level of stimulation that we're living in today and this high level of connection. So there's, one of the things that I love about your book is that it doesn't just, although the first part talks about a lot of this research and the difficulty with research and the difficulty with adverse motivations for promoting drugs over other treatments.
I like that phrase.
The adverse motivations?
Yes, I like that a lot.
So then the rest of your book goes into, here's what you might do about it, and take a look at the traumas and take a look at your breathing, take a look at what you're doing with the brain. As we quoted earlier, my mind doesn't know the difference between my belief about something happening and something actually happening to me. In sports medicine for decades and decades now, they've known people can improve their physical performance on the field or the court by mentally rehearsing in great detail, doing vivid visualizations about the ski run or about the tennis game or about, the golf shot. Because now they know, because they've got these brain scans of functional MRIs and they don't have to wait for the autopsy to look at what's happening in the brain. That if I sit and visualize doing one of those sports, the same areas of my brain light up as when I'm actually doing that sport.
And not just your brain. Studies have shown you can improve muscle strength by imagining using that muscle. Not to the same degree as using it, obviously, but significantly. Yeah. Right.
So if we look at this and we say, all right, so there's a big problem out there. If we get past the idea that my depression means I don't have enough of the right antidepressant in my brain, we get past that and we take a look at the traumas and the energies that I've downloaded in my body, mind system, as they get activated later in life, can be the cause of these symptoms. then what's the first level of assessment you do to help somebody if they come to you? How do you begin assessing a person? If they say, hey, I'm depressed, do you just focus on depression, or do you do a broader assessment?
Yeah. So for me personally, I spend a couple of hours with everyone at the initial assessment because I want to know their story. I want to know how they do perceive the world around them and themselves. And so we start at the beginning. We start with their childhood and looking at events that shape them and shape the way they see their world and shape the way they see themselves and shape the way they see what's safe and what's not safe and all the basic questions, right? All therapists presumably are asking as well, right? These are important questions, but these are not just important questions in terms of our emotional well-being, but our physical well-being as well. So I start there. And then as we go through the story, right, I try to kind of summarize it at the end by normalizing it, right? So these symptoms you're having, right, these behaviors, they make sense given what you've experienced, right? So I try to start with normalization, and understanding of how these totally make sense and helped you survive even, and may even have, they served some advantage at some point. They just didn't come out of the blue. And when we don't acknowledge, and when these things get buried as trauma so often do, right, they sort of, I think of it like a pot of boiling water, right? So you can put the lid on, you can kind of bury it. And that's what so often happens in childhood is you have to keep the lid on it. You're not allowed to talk about it or the family secrets or whatever's going on. And so you just learn to kind of tighten up and hold all this in. And at some point it percolates out and then it doesn't make any sense. Why 20 years later am I having these symptoms when, my life's fine. Everything's going great. I have no problems. There's nothing wrong in my life. I have a great marriage, whatever. I mean, I hear these stories all the time and I'm sure you do too. But then when you start going back, you realize what they've been holding on to for so long. So again, it's just kind of making sense of the story and making sense of maybe what related event may have triggered these symptoms in this moment that relate back to the past. And then from there, it's really a matter then of, okay, so if your brain and body learn to respond this way, we can learn to respond in a different way, right? So we can change those beliefs, change that wiring. And from there, I always just start with basic breathing, right? As a way to start the body, to start to learn and see the connection between how we can, by changing our breath, how we can start to change our mood and our anxiety or right, our sense of how we're feeling in the moment. So most of us, whether we've had trauma or not, just because of our way we live our lives, we tend to breathe tight, shallow breaths into the chest. And when we do that, it's like sending a constant yellow alert or orange alert, depending on how tight it is, to the brain that there's some threat going on. So we might just be sitting on a couch watching TV, and yet, right, we're getting a signal to the brain, that the threat detector in the brain, that limbic part of the brain, saying that, something's wrong. And then our brain tries to figure out what's wrong, which only amps everything up. And then our breath gets even more shallow, everything gets more tight. And so we can just be sitting there and be panicked and have no reason for it. But in those moments, if we can just kind of drop down and start to breathe into the belly, just a simple place to start, right? We can send a different message. We send a message to the vagal nerve, which winds up to the limbic system, that threat detector, the fight, flight, freeze part of the brain, and lets it know, wait, it can put on its brake. It's okay. There's no immediate threat right here, right now. I'm sure things may be looming out in the future, but right here, right now, it's safe, and we're just sitting here on the couch and it's okay. And then the body, it's a direct way to communicate with that part of the brain and let it know we can settle. And what the research shows is that by practicing focusing on the breath for 20 minutes a day, ideally, so it could be broken up into 10 minutes in the morning and 10 minutes at night, which is what I usually have my patients do, you can actually start to change the structure and the function of the brain so that it's less reactive. And less easily get hijacked and get into those fear-based places where we do a lot of the behaviors that feel really out of control, because in those moments they really are.
Well, and in that, it's decades and decades now. I think Herbert Benson wrote in the 70s about the relaxation response and the idea that if I spend that 10 or 20 minutes once or twice a day, gently focusing on something that doesn't take a lot of mental, emotional energy and stress and isn't emotionally loaded, and doing the kind of breathing that sends the message to the body that there's no physical threat, in that period of time, there are other parts of the brain that just jump into activity to do the refreshing, restoring, relaxing, rejuvenating functions that we're programmed to do, that we were born doing as infants and we've been programmed out of. So there's a tremendous benefit just in the breath work.
Yes.
And making it a conscious daily practice. And I have people do it, just take 2 or 3 full deep breaths and slowly exhale. Do that 4 or 5 times a day. For the standard person who comes into my office, if somebody comes in with anxiety, it's a minimum of 10 times a day. Do that. Because they're working to deprogram that heightened, fight or flight response or stress response that's almost at fight or flight that they live in.
Yeah.
And reprogram this idea of safety and relaxation and breathing, as you talked about the vasovagal response, that the vagal nerve being so powerful, running from the brain all the way down through the center of the chest and in the abdomen. I guess sometimes I get excited just thinking, what research are they going to find in the near future about the levels of connection between the cranial nerves and the vagus nerve. Vagal nerve is one of them. And simple things we can do to improve our life quality.
Yeah.
Right? Because we don't just have 1 or 2 cranial nerves. We've got, 12? And 5 of them seem to be associated with senses. David E. Martin put out the idea that if we have 5 senses and there's a cranial nerve for each one, but we've got 12 cranial nerves, what if we actually have 12 senses that we haven't been tuned into? What if there's potential within this energy system that we call the mind-body system to be and do so much more than we've even tapped into yet? So that's where I like the idea of the exercises you give and the way your book unfolds, working through not just the breathing, but the idea of paying attention to what your mind is saying. Can you talk a little bit about that? You've got some exercises there for uncovering my stories.
Yeah. So again, I usually start just with the breath. So focusing on the breath. So basically a form of mindfulness and meditation, right? So which is all just to say, paying attention to what's happening right here, right now, in this present moment. And ideally, I think the more senses you can bring in, kind of to what you were just saying, the better, right? The more you can notice the sounds around you and the sensations. And so right now I'm feeling sun on the side of my face, but not on this side of my face. Right now I can feel myself sitting in this chair. Right now I can feel, I'm noticing my arms are moving a lot because I tend to move when I talk, right? So just noticing what's going on right here, right now. So the emotions, the thoughts, the sensations. And what that does is it brings us back here, because anxiety is all about being out in the future, right? Worrying about what's going to happen next, worrying about my to-do list for tomorrow, or worrying about, what I have to do to get ready for the dinner tonight, or whatever it is, or worrying about what's going on in the world and all the things that are wrong and all the things I can't do in this moment to fix it, right? All those things just rev up anxiety. And it's not to say we don't need to plan for the future and we don't need to think about it at times, but we don't need to spin out over it all the time. We need to come back, especially if we're getting all anxious, we need to come back to right here, right now. And depression is often just the opposite. It's going back in time. So replaying something someone said to you that upset you, whether it was yesterday, this morning, or whether it was 20 years ago, and replaying those scenes or the regrets or the things you wish had gone differently. So really training the brain to stay here. And it is training, no different than, preparing for a marathon. You don't just go out and run it. You have to practice on a daily basis to keep your body strong and supple and flexible. And so it's training your brain to stay here so that it's reducing the stress of all those things we can't control out in the future, and all those things we can't change in the past.
And ironically, that leaves us better equipped to deal with what's happening in this moment.
Right, because then our brain is actually on board and we're able to focus and have a much bigger, clearer picture of what's going on in this moment, so we can make much better decisions. Yeah.
And then you move into, and it may not be the very next segment, but you know, one of the things that's real powerful for me is helping people uncover their habitual negative stories. You know, Michael Singer in his book Untethered Soul talks a lot about how powerful and how negative the internal dialogue is for most of us. You know, he says if you could get a transcript of your internal dialogue for a day, and hand that transcript to a friend and had them read it to you throughout the day, you'd kick them out of your life before noon.
Yeah, it's
because
so
you
cruel.
don't tolerate anybody talking to you the way you talk to yourself.
Yeah. So one way, so as you're in the moment, as you start to notice thoughts, you start to notice, one, how repetitive they are and rather boring, but also how often we keep retelling these negative stories, particularly negative stories. We don't usually retell the positive ones. So for example, for depression, right, the stories are often, I'm broken, I'm unfixable, I can't function like other people, I can't do things like other people, I'm not normal, there's something wrong with me, I'm not enough, I'm not good enough, I don't deserve. And so these stories, not only do they amp up our nervous system again, but they hold us back from being able, they create a cage that doesn't exist. So I use, throughout the book, I kind of keep coming back to the metaphor. There's a story, it was a real story, of Mohini, the tiger. And the tiger was given to the president, so it was presented to the National Zoo. And the National Zoo at the time only had this 12 by 12 foot cage to put this tiger in. And so, while the tiger is kind of growing up in this little cage and just sort of pacing back and forth, the zoo raised money so that they could build this tiger a much bigger enclosure with waterfalls and rocks and gardens and mountains and whatever. But by the time they did, the tiger had learned, had been in the enclosure for a long time. So the grand opening day, they bring the tiger into his grand new enclosure, and the tiger just paced back and forth in the back corner by the 12 by 12 foot space and never left it. The tiger lived his whole life right in that tiny 12 by 12 foot space, and it's beautiful. But we all do this to a certain extent. We all have stories that keep us smaller and contained, and we don't recognize them. But as we start to investigate, we can start to see some of these stories for what they are and start to expand our possibilities.
Well, and hopefully rewrite the stories.
And rewrite the stories.
Have a much more, fortunately for most humans, they have a far more what they're now calling neuroplasticity, the ability for our brains to change and grow throughout the lifetime.
Absolutely. Every thought. Yeah.
Yeah, I've been honored as a therapist to have people in their 70s come to me for therapy and make substantial changes in thought patterns and belief systems and interactions in relationships. And it is a little bit more difficult when you're that old and you have that history of decades of practicing a certain negative thought pattern. Mm-hmm. And it's possible to change it.
Always possible to change it. Yeah. Yeah. With every thought and every action, we change the brain patterns. And so it appears static to us because most of us continue to do the same things and send the same thoughts. And so it appears as if it's a static, unchanging brain, but it's just not the reality. And if we start to change the input, we start to change the wiring.
Right. And as you said from the beginning, if I've been conditioned to believe that my brain is just the way it is, and it's because I don't have the right chemicals in it and I need to take this pill, then I don't change any of the thought patterns, and I do reinforce the belief that I need that pill to maintain, and that's all I do is maintain. I don't grow, I don't expand, I don't find joy usually in things, because as you point out in one section of the book, the medications that are given for various psychiatric diagnoses are not, they're not prone to make people live a joyful, expansive life.
If you reduce sadness, you also reduce joy. It narrows everything. And unfortunately, when we don't have joy, that is depressing. I mean, that's what we kind of live for. No one ever lives in a joyful state all the time. But to have those moments is sort of what makes life so meaningful. And, and so to cut people off from that is
very limiting. It's
very limiting.
Yeah.
Yeah. And that is often why people do come to me, is they start to recognize that. I've had people come to me and say, well, come to me because they were at, their daughter's wedding and they didn't even feel joy, or they were at their mother's funeral and couldn't cry. And they're just, it wasn't that they were, protecting their emotions. It's just they weren't there. They just had been cut off from them. So, and so they just wanted to feel again, and unfortunately, when we cut ourselves off from pain, we cut ourselves off from gratitude and joy and compassion and all the other positive emotions.
Yeah, and that is one of the toughest sells that I have to make in therapy, is that I used to take people into the room where we had the fax machine, and there's this alignment device. And if you're going to send an envelope, you'd move the 2 in this one. If you're going to send an 8.5 by 11, 11 by 14. Well, as you move one, the other moves. You can't move one side of that because it's going to try and keep it lined up in the center. And I would get in there and say, listen, if you want more joy in your life out here on the joy side, you're going to open yourself up to more pain and sadness when the joy ends. And if you say, I just can't stand the pain, I want no more pain, you bring in the capacity for joy down to almost nothing. And it's just the way it works.
Yeah.
Now, and some deep spiritual teachings, they, like Michael Singer's work at a higher end will say, listen, you can get past the point where you interpret things as painful or bad or negative today. You can get past the point where you're interpreting them that way, and then they don't have that impact on you, and you live in that more blissful state. But there's a journey to get there from here.
Yes.
And in the current state for most of us, we have to expand our capacity and our tools for coping with, dealing with the not so happy things in life, if we want to be able to experience more of that joy, gratitude, appreciation, pick your favorite word for that.
Yeah,
and that's another set of trainings and teachings that I think are just far more potentially powerful and beneficial than just numbing out with a pill.
Absolutely. I mean, that is the work for all of us.
So that's one of the things that I was, drawn to in your book, is the idea that you're presenting a way to teach people how to live a more fulfilling life, active and fulfilled, and taking active participation, an active role of participation in the development of your own skills for managing life, for experiencing and managing life.
And just learning those skills is empowering. And empowerment is really the antidote to depression anyway, because at the heart of depression is hopelessness and helplessness, right? So by learning, not becoming dependent on, someone else to fix it for me, or some pill to fix it for me, or some external force, or my life has to change before I can be happy. It's learning these skills so that you can, maybe you're not always happy, but you can be accepting and okay wherever you are and whatever's happening, and can tolerate. Like, I love your analogy of the fax. That's great. The centering device. Yeah. The centering device, that's such a clear image, right? But learning to expand that out, right? So for some people who are terrified of feeling anything, right, you can only expand it a tiny little bit at a time. But you slowly start to move it out and start to just kind of step out of the cage a little bit and be able to live more fully and thrive. Yeah.
Yeah. It's part of it is all of the skill building. And you quote, Thich Nhat Hanh in your work about how peace can only exist in the present moment. And so if I can build the skill of staying awake and aware. Not only is it this great benefit because I don't have to turn around the car on halfway to work and go back and get the stuff that I didn't put in the car, because I'm more aware and awake in the moment as I'm doing my morning preparations, but it also starts to expand the potential for an entirely different experience of my life events.
Yeah. Or if you're like me with 2 kids and a dog and 2 cats, and I still forget things I need on my way to work, but I don't have to stress about it as much, right? I can recognize that it is what it is and then move forward. Yeah.
Right. And for most of us, it isn't, oh my God, it's dementia. It's, oh my gosh, I was really distracted as I was I was thinking about other things. I wasn't really in the moment. So I say, oh, okay. Let me be more awake in the moment now and decide if I want to turn around and go get those things or just drive on to work and do without. And I don't have to add all of that volume and intensity to the negative self-talk or the fear about dementia or whatever.
Yeah.
That so many of us are trained to do, right?
Oh, it's huge. It's huge. Yeah.
In the book Buddha's Brain, it talks about how our brain developed, and it makes really good sense that we evolved to overpredict for the negatives.
Yeah,
right?
the negative bias. Yeah.
Right. If I dive into the bush every time I hear a noise, I might be diving away from a rabbit or a deer that couldn't hurt me. But if I dive in the bush every time there's a noise, I also dive in the bush when there's a tiger or a bear.
Right.
And so I end up surviving more than the people that every time there's a noise, they go, hey, it's a curious noise. Let me go explore and decide what it is. And then they get eaten and then they don't pass on their genetics. And so this level of heightened awareness, and we see it in the police training these days. They actually have dramatically reduced the number of police fatalities as they've trained police people to have this ultra high sense of awareness whenever they have the uniform on. You might be killed at any moment. So they're living their lives at this agitated, almost right at the flight or flight state, and this vigilance for it, and they survive more. The impact on their physiology is increased blood pressure problems and blood sugar problems and diabetes and stress. All of the chronic stress diseases in the police is so elevated.
Yeah. And of course, we don't have to look far to see how that results in behaviors, right? Reacting before it's necessary, just because you're at such a place of hypervigilance. And so, a toy gun becomes, a threat, or someone's facial expression. Yeah.
Right. But then they survive more. So it works, right? It's like how our brains got passed on to be this high level.
Yeah.
We currently don't really live in an environment where there's a life-threatening danger around every corner.
Right.
So that tendency for our brains to overpredict the negative is now counterproductive.
Yes.
And if we can be aware of that and then catch it and call a timeout and question it and say, wait a minute, take a breath. And if my body will let me take that nice, long, slow, deep breath, it's an irrefutable signal to my body that this isn't a life-threatening situation, and the whole system starts to calm down. Then I get a bigger picture to look at, and I make better decisions about where to move next in this next moment. But if I stay in that heightened vigilance and this, oh my God, my picture gets very, very small.
Yeah.
And I'm looking for the outside validation of the inside experience, and it becomes this perpetual loop.
Exactly. And not only that, but when we're stuck in that loop, it influences those around us. So those around us are more likely to be stuck in that loop, especially if you're a parent, right? You're, without question, you're passing that same loop on to your kids, and they're experiencing that same level of threat, even if, again, they don't see a threat around, they're feeling it. And so as we shift our own and become more centered and grounded ourselves, we influence those around us. Right. And that's a trickle effect, which can, so much of what's going on right now, everyone's reacting in fear, and in a cultural way, our entire society. And so each one of us really, I think it's becoming more and more pertinent that we all have to step back and ground ourselves first so that we can see clearly and can figure out what the next best step is for ourselves and collectively.
Agreed wholeheartedly. Well, I realize we're getting close to the end of our time, and I just wanted to ask, as I usually do in these, is there a preferred way you want people to contact you? Where you'd prefer them to buy your book, Healing Depression Without Medication, or another topic that we haven't even touched on yet that you'd like to put out there in this first of our, hopefully, a series of interviews with you?
Well, I can't think of a topic I want to go to right this second, but I will, as far as the book's available anywhere, although I'm a huge proponent of indie bookstores, if at all possible. And I can be found at jodieskillicorn.com is my website, and on Facebook at Mindful Psychiatry and at Dr. Jodie Skillicorn.
Okay, so the book title is Healing Depression Without Medication, A Psychiatrist's Guide to Balancing Mind, Body, and Soul. Jodie, Jodie Skillicorn, Skillicorn. Well, as we talked about before we even started recording today, I hope you will come back for a series of these talks so we can talk a little bit more detail about some of the corrective skills that you teach people. And I'm thrilled to have this book as a resource to refer my patients to, and I look forward to our next conversation.
Yeah, me too. That sounds fun. And thanks for having me. I enjoyed talking with you.
It's a pleasure. We will talk again soon. Thank you so much.
Okay, take care.
Dr. Jodie Skillicorn is board certified in psychiatry and neurology and a diplomat of the American Board of Holistic Integrative Medicine. After graduating Phi Beta Kappa from Skidmore College with a BA in English and working for nearly a decade as a photojournalist, she attended Ohio University Heritage College of Osteopathic Medicine. She completed her psychiatry residency at Northeast Ohio Medical University. Dr. Skillicorn is the author of the book Healing Depression Without Medications, a psychiatrist's guide to balancing mind, body, and soul. At her private practice in Stowe, Iowa, Dr. Jodie Skillicorn integrates conventional medical training with evidence-based holistic methods that include breathwork, meditation, yoga, mindfulness-based cognitive therapy, eye movement desensitization and reprocessing, known as EMDR, emotional freedom techniques, mind-body medicine, nutrition, exercise, and auricular acupuncture. Dr. Skillicorn believes strongly in the body's ability to heal itself if given resources and support, and the importance of empowering patients to take back their own health through simple but effective lifestyle changes.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.